Hello everybody. Welcome back to my channel Preventive and Social Medicine. My name is Dr. Mehta, first year resident in Community Medicine Department. So in the previous video we have discussed about specimen collection and lab diagnostic methods in monkeypox disease. In this video we will discuss about the symptomatic management of the patient. Like patient presents with high grade fever, we have to manage the fever and pain. Fever is managed by external cooling, by removing garments, apply cool, damp clothes, antipyretics, and pain medication. Paracetamol, non-steroidal anti-inflammatory medication should be avoided if the patient presents with any ulcers or bleeding or dehydration. Opioids are given wherever they are indicated. Then skin care. Rash may lead to severe or permanent skin damage and fluid loss. So we have to take care of that. Rash and skin care. We have to advise the patient avoid touching and scratching the lesions, gentle washing and moist dressings, gentian violet or nystatin cream, topical or oral antibiotics as needed. In case of inguinal or genital ulcers, we have to advise the patient like treat with warm saline sitz bath or a light soft tool dressing. Then mouth care. So the patient also presents with mouth sores. So the mouth sores can be very painful. We have to advise the patient wash the mouth with warm, clean, salted water. You have to minimize the mucosal pain with oral or topical analgesics. For severe ulcers, consider gentian violet or antibiotics. Vitamin C and other multivitamins should be given to the patient. Then eye care. Eyes may develop infection or ulcers. So vitamin A supplementation to the children and protective eye pads should be offered to them. Topical or oral antibiotics in combination, tetracycline or trifluridine eye drops or ointment. So this is a case of active infection. So we shouldn't use steroid ointments or drops in these cases. So respiratory care. So bronchopneumonia is one of the complication. Bronchopneumonia and abscess are one of the complications of monkeypox disease. So management of respiratory symptoms or distress, suctioning of nasopharynx or airways to clear the secretions, incentive spirometry, chest physiotherapy, bronchodilation, nebulization, oral or IV antibiotics, oxygen supplementation and ventilation support should be given to the patient. Then rehydration and nutritional support. Vomiting and dehydration, vomiting and diarrhea leading to dehydration is one of the complications of monkeypox. So we have to ensure the patients eat and drink liquids like water, soup. We have to advise the patient to increase the liquid intake. They can take water, soups, tea, oral rehydration solution. Intravenous fluids, if needed, should be given to the patient. So we have to treat the conditions affecting the nutrition of the patient like mouth sores, vomiting, diarrhea. For young patients, we have to give oral vitamin A supplementations. So breastfeeding should be continued. Breast milk or infant formula should be given according to the situation. So mental health and social support. Normally, because of the long-term sequelae, so patient might be feel depressed because of those scars and the pock marks. So we have to provide psychological support by psychologist or social worker or specially trained nurse. Offer non-intrusive practical help to calm the patient and family, keep them informed about the condition, what to know and what to expect and how to care for themselves and how to take precautions. So we have to follow the standard infection prevention and control measures like standard precautions, risk assessment, hand hygiene practices, respiratory hygiene and cough etiquette. PPE as required should be worn by the healthcare providers. Injection and medication safety, cleaning and disinfection procedures, and waste management. Those collecting samples should also wear PPE before taking the samples from the patient. So in the next video, we will discuss about the isolation of the patient, the standard case definitions of the monkeypox disease. Thank you.